Hello, and thank you for joining us. I'm David Amilati, anchor and reporter at KMOV Channel 4, First Alert 4. So glad to be with you. I just gave you a couple of titles, but another title that I'm really proud to have is an Eagle Scout. And like my dad always told me, once an Eagle, always an Eagle. And so getting to spend some time with you and Scouts BSA for a really important reason. I'm really excited because the conversation about mental health is really timely. Today is National Mental Health Day. It is something that is a challenge for so many of our young people and so many for our older members of our community as well. No one is immune to this, and so we're trying to raise the awareness. Scouts BSA in the greater St. Louis area actually made a plan going back in 2023, a 3-year strategic plan on how to address the mental health needs of our community. And so we're going to be discussing what the climate is right now in our community. While Scouts BSA might not be the health professionals, we have assembled a panel that is very experienced in helping people of all ages with mental health and the mental health challenges that we're seeing in our community every day. We've brought them in. I've been brought in to moderate this panel. I'm by no means the expert, but I'm really excited to be part of this conversation. Of course, this is sponsored by SSM Health Behavioral Health, and we want to start things up with an introduction of all of our guests. First things first, thank you for being here. Melinda, we'll start with you. A quick introduction of who we are and why we're here.
Well, thank you for having me here today. My name is Melinda McElhiney, and I am the Executive Director with Community and Children's Resource Board of St. Charles County. We partner with and provide funding to 38 nonprofit organizations who work to address the mental health and substance use prevention and intervention needs of children and families in St. Charles County. We are funded through an 1/8 of a cent sales tax in St. Charles County.
Thank you, Melinda.
I am Stephanie Moore, the Vice President of Behavioral Health Services with Human Support Services. We provide professional counseling, substance use services, as well as intellectual and developmental disability services for individuals within our community.
Hi, I'm Dave Hases. I'm with the St. Louis Mental Health Board. I'm the Director of Clinical Partnerships there. And like Melinda, we do something very similar in the city of St. Louis. For the city of St. Louis residents, we fund both community mental health for adults and for children.
Hi, I'm Dr. Drew Sakrani. I'm a child and adolescent psychiatrist, as well as an adult psychiatrist with Compass Health Network. We are present in St. Charles County and really all across the middle of Missouri. And so we have a great stake in having the mental health needs of our adolescents, our children, and our young adults, our adults, in progressing and being very well aware.
Dr. Bart Andrews, I'm the Chief Clinical Officer at Behavioral Health Response, or BHR. We man the local 988 provider and answer 988 calls for St. Louis City, St. Louis County, and the Youth Connection Helpline. We're incredibly grateful to our partners, the CCRB and the Mental Health Board, because we wouldn't have that Youth Connection Helpline without them. Very important. And if you're struggling, need to talk, you don't need to wait for it to be a crisis. You can just call 988. That number is there for you. Or if you're worried about somebody else, call 988.
All great advice. I'm going to have you pass that to Melinda because we're having Melinda kind of kick things off. We want to talk about what is the climate of mental health needs in our community post and pre-COVID-19, the pandemic. First things first, though, can we get a baseline definition? What is mental health?
Sure. According to the World Health Organization, they define mental health as a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community.
Wonderful. And so what does the climate look like post and pre-pandemic?
Yeah, so let's give a little bit of information about what does that look like when we're talking about young people. A couple of stats that just to share with everyone is that 1 in 7 teenagers will experience a mental disorder. Yet only 51% of kids with a mental health condition will get treatment in any given year. So while there is a prevalence of it, not every child is getting access to the services that they need. Anxiety disorders are the most common mental health disorders that we see amongst children, affecting almost 32% of teens. As I was preparing for today, was talking with a number of our funded agencies, just asking them, what have they seen since COVID? And without question, some of the themes that they're seeing among the children and youth that they serve is increased anxiety. So again, the number one mental health disorder among children, they're seeing more of that. They're also seeing young people presenting with more complex conditions than what they'd seen before. Also, an increased level of aggression that with COVID, a lot of times, especially younger kids, didn't have the same access to social emotional learning opportunities or social skills learning. And so they have these emotions, but don't necessarily know what to do with them. And so they're acting out in aggression. It's not wrong. It's just as adults, how do we understand what's going on with our kids? And the final thing that agencies are telling us is that they're seeing families with increased levels of stress. That as we've had inflation, it's more expensive to live, and so it's more expensive to provide those basic needs. And so particularly if you're in a low-income family, providing for those basic needs are becoming harder, which increases those stresses, which impacts that kiddo in that family unit.
Now, we did mention once already 988, right? That is a number that we can call if you need help or you know someone who could use those resources. And so we want to make sure that we mention that a few times today. I want to pass the mic to Stephanie because I want to know about what steps adults, parents involved in the lives of our young people can take, either recognizing or responding to youth who are experiencing mental health needs, maybe before it gets to a crisis.
Absolutely. The first thing I believe is gravely important is the rapport that we have with our youth. If we do not have sound rapport relationships with the individuals, with our youth that we are connected with, then oftentimes our youth are not going to be willing to open up. And that's the other piece. We have to have that open communication. We have to be able to ask those open-ended questions just to get to know what is challenging the youth, what is the youth experiencing, what is it that we don't know that we don't know, and we don't know these things until we at least have that level of rapport and understanding that this is a safe place where the youth can come and speak with. Additionally, I think it's important for us to educate ourselves, parents, educators. We have to know what circumstances are surrounding these children that we are engaged with and what they might be experiencing so that we can understand how we can better help them.
So as a follow-up question to that, what are some preventative measures that can guard against that risk of mental health crisis?
Sure, absolutely. So being able to have a level of communication, so asking those open-ended questions. In addition to that, we also want to be sure that we are providing support. So sometimes or youth will bring issues to us that we might not necessarily seem as grandiose, but for them it might be a big deal. And so we have to be able to at least give them some area of support so that they can express themselves.
Drew, did I see you raise your hand? You want to chime in here on this topic? Go ahead.
Thank you. We are in a generation in which our children are now asking us for help. This is a generation that has emerged from a pandemic, and it has a very unique experience of experiencing stress in the schools in terms of violence, in terms of gun exposure. And our children are now asking us for help. So actually, speaking through the experience of Compass Health Network, partnering with a lot of the agencies in St. Charles County and across Missouri, especially with the St. Charles County Resource Board, we have now started to take services into the schools, actually making our presence felt there and putting that message out to kids. If you see something, say something. If you hear something, say something. And when children want those services, is to make those services available where they are, rather than interrupting the day.
So you just mentioned the programs, the services that we're bringing into schools to meet the kids where they are. What opportunities are there for young people to support young people? David, can we pass the mic to you on this one? I'm kind of curious. You know, I made the comment at the beginning of this that Scouts BSA does not say it is the expert in mental health, but I would feel like that's a program that benefits young people to be with each other, right?
Well, it's interesting that you say that because I was thinking about preventative measures, and one of the things that actually happened yesterday that I was at a Cub Scout meeting with my daughter, and what they were focusing on was physical health. And so they were teaching them like this physical health and that kind of stuff. And we started doing calisthenics, and then we played kickball and that kind of stuff. And the joy that I saw on the faces were awesome, So it's just like, and you talked about opportunities, and these are opportunities that we need to constantly give the kids, because if we don't give them opportunities to be able to support each other, then it's like being there and being able to like model for them, what's needed, and the other preventive measure that I thought about also was adults taking care of themselves, the parents taking care of themselves, and recognizing what's going on internally here, and the more you take care of yourself, the better you're going to be able to
Because our young people do model what their parents do. When it comes to the do's and don'ts, you find a young person that you suspect needs help. Bart, I'll kind of bring it over to you. We'll bring the mic over to him. What are the do's and don'ts when we want to approach a young person to give them the support we think they might need?
This is really important, and some things we really need to talk about that are incredibly important to get out there is we have new and increasing evidence that, in fact, a lot of our awareness campaigns are actually making kids unwell. So in other words, one of the things that's going on is that because you're anxious doesn't mean you have an anxiety disorder. Because you're sad doesn't mean you have depression. And on social media, kids are literally diagnosing each other, and this is a huge problem too. We have not instilled resilience in our children, and we keep telling them horrible things about how the world is horrible and the future is horrible. Sorry, folks, the world's better than it ever has been. Believe it or not, during COVID, the suicide rate among youth plummeted. It didn't actually rebound until they returned to school on site, which is a separate issue.
And why do we think that was?
Because there's a couple of prevailing theories about this. One theory is it's about sleep deprivation. One of the huge challenges that youth have is that they're up late and then they have to get up super early for school, and it disrupts their natural sleep patterns. And during COVID, when they were at home, they were getting normal amounts of sleep, and sleep is incredibly important. So when we talk about things that we can be doing with our youth, make sure we're making sure they're getting enough sleep. That's huge. Make sure they're eating appropriately, right? Some other things around this that are really important. We need to differentiate negative emotions and the natural pains of life that we all go through from mental illness. And we've done, I'm sorry, a really bad job of this. One of the things that's coming out that's really interesting, and the doctor really appreciate this, we're finding that kids that are more likely to be diagnosed with attention deficit disorder are the younger kids in their classroom. And so what we see is the younger kids who may be 9 months younger than their peers obviously look a little more immature. They have a little more trouble controlling their impulses, and we're diagnosing them attention deficit disorder. Maybe not. Maybe they just need to grow up a little bit. So we need to do a couple of different things. We need to normalize negative emotions, sadness, anxiety, feeling scared. These are things that are a natural part of the human experience, and separate that out from having a mental health disorder, which is a very specific thing. 2, we need to make it okay to talk about our negative feelings. We need to normalize those negative feelings, and we also need to talk about individual accountability and internal locus of control. One of the biggest differences we're seeing in our youth these days is everything's externalized. I feel bad because the world's horrible. This message is coming from so many places. It's really unhealthy, y'all. Negative emotions and an external locus of control are correlated with so many bad outcomes, and we really need for our youth to recognize, yeah, things can be tough. Let's talk about what you can do about that, what action you can take, right? And also we want to make sure that folks know that help is available. The idea of getting help in schools, oh my God, that they can access care inside of a school is so incredibly important, and we're going to get some big dividends from that.
No, I appreciate you saying that, because sometimes I think I hear parents, and I'm a young parent. I have a 20-month-old at home. I don't know, are we all parents on this panel? Any kids? Okay, cool. So some of us say, okay, cool. So you just want to know, when your child starts getting older and starts showing signs, is it an awkward phase? Can you just assume they'll grow out of it? Or how do you know when you actually need to step in and provide some support for them? Is there anyone who would like to tackle that one directly on? Drew?
There are lots of awkward phases in life. Lots of them.
I feel like I've experienced some right now.
Absolutely. And it's okay. It's okay. A 2-year-old will have tantrums, and a 2-year-old is described as having ADHD, but it is not. It is the natural immaturity of the neuromuscular system. That's why you have hyperactivity, you have inattention. And that is the role of the parent, is to find out where they are in developmental milestones and to keep saying, no is a valuable lesson. the way that we guide our children is absolutely important, because whether or not we consider them as looking at us, we are their first models. We are their first role models. The other role models are so far away. So if we know how to manage our anger, that's what they're seeing, that's what they're hearing, and that's what they will do. If we tell them, hey, it's time to sit down and count to 4 or count to 3, that's what they will do. And yet, you also have to partner with teachers, finding out in early life, are they verbal? Are they aggressive? Are they agitated? What can we help with behavioral modifications at home, at school? What services can be done? Because, like, not everything is pathological. Not everything needs to be brought to the forefront and identified as a difficult situation.
And I've heard ADD mentioned a few times, and so I'll go on the record and said I was diagnosed, and I'm an April baby. So now I'm starting to wonder if I was one of those young kids that was really immature with all my friends. Want to ask about sleep. I want to ask about social media, monitoring the time that our young people are spending on social media, because I've heard both mentioned already in this conversation. Melinda, I'm seeing you shake your head quite a bit. I mean, how do we approach talking with our kids about the importance of sleep, the importance of an appropriate amount of time on social media to help them succeed?
Right. Well, especially as your kids get into teenage years, those kinds of conversations are hard to have because they don't want you to tell them what to do. I think from a sleep perspective, I think, Bart, you were straight on. Research is showing that once you move from your young childhood years into teenage years, your natural sleep rhythms change. They flip-flop, and then they flip again once you get into adulthood. And so that kids they will stay up later and they need to sleep later, but yet school starts in high school at the before the crack of dawn. They're walking out and waiting on the school bus. And so having those conversations and starting those healthy sleep habits when they are young. Don't wait until they're a teenager or they're a tween to start addressing this from the offset, as 2-year-olds start talking about and encouraging and practicing those appropriate sleep habits and healthy sleep habits, and as a parent modeling that for yourself, so that once they do get into those teen years, it's easier. They've already developed some appropriate sleep habits. One of the things, my kids are 17 and 19, and one of the things that we did very early on moving into social media was that we had a policy, and we still do. They don't like it as teenagers, but we still do. And we practice this as parents, is cell phones are not allowed in bedrooms overnight. They stay in the kitchen. They're all plugged in the kitchen. And so that means that kids aren't having access to that phone at night. They're not staying up or being, encouraged to stay up late. It's good for my sleep health and my mental health to not have that phone in my room and to potentially just lean over and start scrolling, the doom scroll, and an hour later I'm still up. So that's another thing that you can practice is just, where you have that phone and having those conversations rather than saying you're not allowed to do this or you need to get off this, is having those conversations about the why. Why is it, why am I concerned about you having access to this app? What if and let's talk about this. And then let's talk about how do we develop some healthy habits together. And again, as a parent, what am I modeling?
I'm seeing a lot of panelists here nodding their head. Bart, maybe you want to jump in here too, but I'd like to say, with Scouts, what do we say in the oath? Anyone familiar with the Scouting program need to be physically strong, mentally awake, morally straight. And those 3 components all play a big role in one's mental health. And so if you have a young person, how you talk to them at 5 is different than 9 and different at 13. So when we're thinking about our, Scouts, for example, you have to elevate that conversation, right, as they get older?
Yeah, so we're going to talk about some things that are really important because the data on social media causing mental health distress in youth is falling apart, and it's falling apart quite rapidly. And there's issues with this because when kids are struggling emotionally, they're more likely to be on their phone. So which is causing which? And more evidence is saying, hey, when we do find effects, they're very small effects. At the same time, the things we're talking about here are really important. Kids need to learn how to control their use of their phone. They don't need to have their phone 24/7. They don't need to have their phone next to them when they're sleeping. In fact, I am absolutely for phone bans in schools. Kids need to learn how to relate with each other without their phones. Now, we need to be careful about that because it turns out some kids benefit from their phones. There are kids that particularly belong to LGBT community or may belong to a community where they don't feel like they belong, and they're finding people online that they're connecting with and feeling connected to. That's a good thing, not a bad thing. In fact, Utah did a study of all their youth suicides back in the teens, and they found that a large percentage, about 14% of the suicide deaths, were teens who had just had their phone or computer privileges taken away. Now, that doesn't mean that that caused their deaths, but we need to be very, very careful because we don't have a lot of clinical evidence about what happens when you do take kids' phones away. So some things that we're talking about now that make a lot of sense is that phones probably have good and bad things about them. There are some kids that benefit more than others. There are some kids that are hurt more than others. Kids learning to control their phone use, learning to put the phones away, and make them put the phones away during school time, I think is a wonderful idea. And we need to model that because if they're on their phones, they're not learning how to cope with these emotions in other ways other than being on their phone.
As we see the impact of mental health expand, especially with their young people, you bring up the phone example, probably a lot easier to monitor the use of a phone 20 years ago when you just had a Nokia or you just had that basic flip phone where you could call, you could text, and that was it. Now you have the power of the internet right there in the palm of your hand. That probably is a little bit more difficult for a 13-year-old to understand the responsibility of having that connectivity. I would like to ask, Stephanie, I'd like you to weigh in here. We've talked about so much already. At what point do we as a parent or a mentor need to say, okay, this young person, I think you'd really benefit from some professional help?
When it starts to interfere with their daily lives, when we see that this youth is not engaging in activities that they used to engage in, when they have become more isolated, more withdrawn, we see a change in sleep patterns, a change in eating habits, we see a change in academic performance, all of those things on a consistent basis, right? We have to understand that consistency piece. When we start to consistently see these things, then we have to say something isn't right with this situation. Maybe we need to go and seek out some additional professional help just to make sure that it's not just an awkward phase or it's gone beyond that awkward phase, right? Transitions in life are normal. And so we have to see that this is starting to impact their daily activities. And when it's impacting their daily activities, then that's when we definitely need to reach in for some additional supports.
I don't want to speak for anyone who is struggling right now, but maybe it's difficult when you have to accept or you have to at least be open to the idea that maybe I do need help. And now you're being told to talk with this other adult in the room. And you don't know who they are. And why are they telling me how I should think, how I should feel? Even if they're trying to give me comfort, how do we approach with the young person, because of the mental health challenges they're facing, distrust in that professional help? How do we talk to them about that? David, is this something that you want to weigh in on?
Sure. Yeah, I think distrust is an ongoing issue, with kids. It's constantly building, like you said before, a rapport with them, and as a therapist, the first thing you're doing is building that rapport, is like sitting down and sometimes I've taken a walk with kids, to again give those opportunities to experience things that are not necessarily like that clinical base, but with the same thing with being in schools and that kind of stuff, is the parents being involved and going to the teachers and saying and making it very predictable for kids, is the other thing that really needs to happen, is this idea of okay, here's something that's happening, we're going to be doing this thing, and then it follows through that way, is really important.
So what I'm hearing you say is, you're making a promise and you have to have the follow through so that way the young person is able to develop that trust.
Correct.
Drew, you want to chime in here?
Yes. I would say that now we put it in a flow such as go to a person you're familiar with. That person who is familiar with may not be able to do anything for you, but can access somebody else for you. And because eventually who needs to be involved is the parent. So if you tell a friend, hey, I'm not feeling well, I really want to hurt myself, that friend should be comfortable enough whether it's a teen, whether it's an older person, comfortable enough to say, hey, let me see what I can do and let me get you the help. I can tell my mom to call your mom. Or if you're in school, let's go to Miss Smith, our counselor, and let's see if we can talk to her. These are familiar people. Miss Smith can access school programs, outside programs. And so here is another thing that we have put in place through Compass. All our offices have an 8 to 4 open access, that if somebody is not feeling well, they can go and be evaluated for anything that is going on. And we have just opened a youth behavioral urgent care, that if you feel that people around you cannot handle it, that they can get more help from there. So we're moving from the familiar to the unfamiliar. And hopefully, as you go from step to step, it is a gentle movement in which you build that trust, you build that rapport, because what we want to really give or preach to this generation is that you need to be a part of your mental health, mental wellness, mental progress, because if you experience a good experience when you're younger, you will have a tendency to continue that mental health care as you get older and find that actually it is as easy as exploring physical health.
Bart, you feel like there's anything that needs to be added to this conversation of establishing that trust between young person and help?
There's some really key things we need to talk about, and we need to talk about our boys. Because one of the things that's not getting enough attention is that there are boys that are really struggling. Are you ready for some important facts? We are down to 35% of undergraduate degrees to going to men, and it will be less than 30 in the next 5 years. On historical black universities, we're down to 25% male applicants. Boys are dropping out of school. They're not going to college. They're struggling. Here's some things that are going on. There's an active campaign that says masculinity is bad. This is horrible. It's not helpful. And in fact, research is showing having a negative view of masculinity if you're a boy is correlated with negative health outcomes, not positive health outcomes. Look who's in our buildings, who's in our mental health professional buildings, who's in our schools. Predominantly women. 90% of psychologists are now women. Most teachers are women. Where are the men's role models? This is really important for scouting, because one of the things that we're missing is positive male role models, positive aspects of masculinity. What do we tell a boy who doesn't feel manly enough in school? We tell them stupid things like, "Oh, it's okay to cry. You can do this. You don't have to be like manly." Actually, that may be really unhelpful for that youth. There are some youth that may benefit from that message. We really need to start attending to the fact that boys require different services delivered different ways. We talk about cultural competence all the time. What about the cultural competence of working with young men? They are a different population.